Working with a 29-year-old man, he's been a patient of mine for many, many years, ever since he's been a teenager, and he had a flare-up of low back pain recently. So he asked me the question. He's a young, fit, strong guy. What he was doing was moving his office from one place to another, lifting heavy equipment. So it could bother anybody to do that, right? So we talked about that. He said, you know, you're strong in the gym, but when you're lifting bulky things that are difficult shapes and larger and so forth, you can lift with all the good techniques you want. It's just, it could have a potential to hurt you. So he kind of understood that. The example that I use to people is, if I was to put a lawnmower on the back of a pickup truck myself, there's no really good way for me to lift that in a safe way, right? But if two people lift it, no problem. The two of us can get into good positions, pop it right on there. It's way more than twice as easy. So if he's moving desks and file cabinets and chairs and so forth, right, it's going to be difficult to do it even though he's big and strong. So he understood the mechanism of the injury. So he flares up his lower back, and then he asks me great questions. And we're going to build what we're going to talk about here from an acute pain standpoint, but most importantly, a prevention standpoint, which he was really interested in. He knew the acute pain was going to go away once he understood it, but he really wanted to ask me, not only what did I do, but I don't want to do this again, so what should I be doing about it? These are discussions that I have with all of my patients coming in. So the first thing, of course, is appropriate chiropractic care. So with the chiropractic, we identify where the problem is. We want to make sure that there is the appropriate chiropractic solution to it, hopefully. If it's something that's beyond our control, if we suspect a bad fall with a potential of fracture, or there's a really serious disc herniation pressing on a nerve that might need surgical intervention, we refer that out immediately. Or if there's other types of sources of low back pain, we want to identify that. But if it has a chiropractic potential solution, we move ahead for acute pain care, but also prevention chiropractic care, coming in and making sure that I'm feeling good, Dr. Fuller, I'm feeling good, see you later, thanks. Well, maybe we want to be working on that a little bit better, right? So then there's that prevention chiropractic wellness, okay? Secondly, appropriate spine flexibility and postural exercises. We've talked about that many, many times on here. Once again, talking with somebody else today, we were talking about yoga. And I'll use myself as an example. If I'm in your yoga class and we're doing like a Superman type of thing where you're lying on your stomach and extending your lower back, I don't do that because I know it's going to hurt my back. So we have to find the roadmap of the appropriate exercises that work for you that might be slightly different than the next person here or the next person here. The 91-year-old man walking in with a walker like this, I'm not teaching him a variety of exercises to do. I might only teach him one, which is this. But that can bring him great relief, and that is the case of my 91-year-old patient in a walker. That's his one exercise, and it's going great. So we need to figure out which ones you can do, which ones you shouldn't be doing. Number 3 is general exercise, general fitness. So just an exercise program that works for you. So the more fit we get, the better our blood flow to our discs and joints and nerves and brain. So the more fit we are, whether it's resistance training, cardiovascular exercise, or both, our body's going to work better. We're going to be moving our tissues and joints, which are going to stimulate all those nerve endings that fire into the nervous system and the brain, and it keeps everything working better. We're going to have better blood flow with better activity to the brain from general physical exercise. But once again, we have to figure out what's right for you and what's not. We don't want to just ship you off to a gym and then you start doing things, I'll just say, you're doing deadlifts, but your back isn't right, and then you injure your back and you have to come back in and see me. We don't want to do that. Just today, a woman came in with a flared up low back pain because she was doing a cable extension for the glutes. And she found out, I was kind of extending too far backward. Lots of people do those exercises without a problem, but in her case, extending it too far backward pinched the joints in her lower back, causing low back pain. Her modification of that is going to be, she's going to extend the leg backward only about halfway and do an isometric exercise. So we had to work our way through that, figuring out the exercise program that's going to work for her to keep her fit, but also not irritate the spine and so forth. We need good posture when we're working out as well. I've talked about that in prior shows here. So you've got chiropractic care ongoing as a preventative. You've got spine stretches that you're going to be doing every day, like brushing your teeth, and then you're going to keep yourself appropriately fit. And of course, before you do any of these kind of things, check with your doctor first. Check with your doctor to make sure that these things are appropriate. Next is diet. Now, people think of eating having a clean nutrition program. I want to move away from the word diet because diet sounds temporary and difficult. We want nutrition to be appropriate, long-term, and satisfying, right? So a lot of people will think of, if I'm overweight, that's causing compression on my spine and discs and joints, and that's why. And if I lose weight, there's less compression. That is some of the component, but an equal component is systemic inflammation, okay? When our body is dealing with inflammatory foods, processed sugars, and bad oils, and omega-6s, and all these kind of things, it's causing inflammation. If we're having more insulin that's being released into the system because we're overwhelming our body with foods that are not working for us and just too much food, then we're going to have inflammatory problems, which sensitizes pain nerve endings, and we're getting more pain. We're getting pain not only from the compression, but we're getting pain from inflammation. So if we eat a clean diet that we can enjoy and stick with, then that's going to help all parts of our body, and that will also help circulation, right? Less stress in the heart, cleaner open blood vessels, better blood flow to the brain. All of these are going to be helped by a cleaner diet. The last part of it, though, and I spend a lot of time with my patients on this and a lot of time here on this show with you, is ergonomics. When I say the word ergonomics, I'm talking about all of the daily stuff that we do. I just had recently somebody who said I was cooking a lot. I had that slight bend like this, doing my thing, and my back hurts. So I showed them the spread eagle. So we get down a little bit lower so the counter surface is a little bit higher up, so we don't have that slight bend for periods of time, whether we're doing dishes, a hobby, assembling a puzzle, long-term cooking like this. We have to get ourselves more upright like that. It's the way that we bend, lift, sweep, mop, shovel, carry grocery bags, open doors, whatever we might be doing. Just worked with another couple that's picking up the child, and we talked about how we can modify that, getting into more of a squat position, the art of bending over that we talked about in here, ways to put more pressure on the legs and the glutes instead of always bending from the back. It's easy to bend from the back and pick up the child and the dog, but we don't want to be doing this because that's going to injure ourselves. That's what I mean by ergonomics, all of the things that we do day to day. The people that hurt themselves with the case of water in the shopping cart on the bottom and then struggling with that going in, and we do that over and over again until our back hurts, changing that into getting a water filter at home so you're not buying and lugging around those cases of water. That's what I mean by the ergonomics. And then of course sitting ergonomics. So many of us sit all day long in front of the computer, so we need to change those ergonomics with breaking it up with frequent breaks, doing appropriate spine stretches, making sure we're moving our body enough during the day, not sitting for 3 hours and then aching and then getting up. We want to have a strategy of making sure we're interrupting that sitting position as best we can. Now that stand-up desks are more popular, I find that people are standing more, but they might stand with a slight lean. So just yesterday, I was talking about standing strategies for a patient. They would have one foot in front of the other and then one foot back, and then they would switch the feet back like this. Maybe they would have a small stool in front of them, put a foot up for a while, put another foot up for a while, so they're constantly kind of moving around as they're standing to deal with that ergonomic situation. So that's what I mean by doing the best we can to prevent these neck and back problems so we don't have to deal with the acute things down the road. I'm Dr. Scott Fuller.